Let's all start with a quick prayer in the name of the Father, and the Son, and the Holy Spirit. Amen. Come, O Holy Spirit, fill the hearts of your faithful, and enkindle in them the fire of your love. Send forth your Spirit, and they shall be created, and you shall renew the face of the earth. And let us pray. O God, who did instruct the hearts of the faithful by the light of the Holy Spirit, grant us in the same Spirit to be truly wise, and ever to rejoice in his consolation through Jesus Christ our Lord. Amen. Mary, seat of wisdom, pray for us. All right, well, welcome, and thanks all for being here. I really appreciate it. I'm going to be talking about primarily the medical consequences of contraception. The outline of the talk is I'm going to start with general considerations from a theological and philosophical perspective, and then move on to some sociological consequences, not the main focus of the talk. Then I'll get into the medical consequences, focusing, of course, on chemical contraceptives, or also known as hormonal agents. I'm going to end up with some ways to discuss contraception, and I will add conclusions, and then there will be a shameless plug. Okay, so don't let me forget the shameless plug. So let's start with the theological considerations that I was talking about. The church teaches that about the inviolable dignity of the human person made in the image and likeness of God, and the nature of the human person who has a physical and a spiritual aspect, and that these are inseparable. Now, I think this is really an important thing to note. This is right from the Catechism. The unity of soul and body is so profound that one has to consider it to be the soul, the form of the body. In other words, it's because of its spiritual soul that the body made of matter becomes a living human body. Spirit and matter in man are not two natures united, but rather union forms a single nature. So this is a very, very profound union. And I think that this is one of the reasons why Blessed Pope Paul VI got it right when he wrote Humanae Vitae, because he understood this at the deepest level. So when you think about the Christian, or especially Catholic Christian view of the person, it's a holistic unity of body, mind, and spirit. So I just quoted from the Catechism on that. Therefore, there's a consequence to that. Whatever affects the soul should affect the body, and vice versa. So that has some implications. If this is true, spiritual sickness, in other words, sins, and spiritual health, in other words, virtues, should have physical, psychological, and sociological consequences. And I think this is something that I can't overemphasize, because when we talk about church teaching on things, a lot of times, one of the things I like to say to people is that there isn't a single thing that I believe just because the Catholic Church teaches it. All right, that sounds like heresy, I know, but it's true. But on the other hand, I also like to tell people, but if I look at any of the church's teaching and actually objectively look at them, they are true. And so they deserve to be believed. So, and I think that this is one of those profound understandings of the human person that the church has that allows people to draw conclusions in the church which are true. And I love this quote from Christian Brugger: "Evil acts are bad for us, even if we choose them in good faith." Okay, so all you priests and deacons out there, but especially you priests, I think there's a lot of tendency in the Catholic culture today to think, to talk about, or to think primarily about sin in terms of what somebody is guilty for, what is going to be, come Judgment Day is going to catch them, and that's important for confession. It's important, it's very important. But when we do evil acts, even if we choose them in good faith, they're still going to be bad for us. So that's something that we can't lose sight of. So let's talk about Christian sociology. Here's a question. Now think about sociology, it's the study of human relationships. What is the most fundamental human relationship, right? Well, yeah, marriage, and especially the marital act. because without the marital act, there would be no humans to form relationships, right? So sociology starts here. It starts with the marital act. And therefore, it follows very logically that disrupting the marital act by eliminating one of its essential aspects, either the unitive or the procreative aspects, will have definitely sociological consequences, okay? And I think, we can go through some of those. And so life begins with the marital act. This is the most fundamental of human relationships. And contraception and in vitro fertilization separate the unitive and procreative aspects of that act, and that has consequences. So the spark of life, I think we should keep in mind what it is that contraception is trying to avoid, okay? And this is the first visible sign I'm about to show you, that an egg is fertilized. It is the recently discovered zinc spark. Now, I'm not saying that ensoulment happens at the moment of the zinc spark. The church has not ruled on when ensoulment happens. But I can tell you scientifically that from the moment of this zinc spark, there is a new organism. Okay, and so if you look at, and you can see in this diagram here, I'm not sure if the pointer works. No, it doesn't work. But the little, let me go up again. The little purple thing on the side there, that's the nucleus of a sperm. And it is attached and starting to fuse, the membranes are starting to fuse between the sperm and the egg. And what happens next is that there's this spark. And, that actually prevents that newly formed embryo from merging with another sperm, okay? So now, at this point, you have this one cell. The nuclei are still separate. They haven't fused yet. But the chromosomal and genetic makeup of that organism is now fixed for the next however many years, okay? It could be a few days if there's, particularly if there's use of some contraceptives or abortifacients, or it could be 110 years, okay? That's fixed from that point. This is a new organism, and this is what contraception is about, is trying to get rid of. This is what our society has a great fear of, okay? They have a great fear of children for some reason. So, well, it's true, right? People, it's what they're trying to avoid, We're trying to be, I need protection. What are you being protected from? Babies? I mean, that's a threat. Babies are a threat to people. Okay. So what are the consequences of contraception? So in terms of moral issues, separating the unitive and procreative aspects of the marital act treats individuals as objects for sexual pleasure, not as children of God, made in his image and likeness. Now that's all contraception, barrier methods, whatever. But chemical contraceptives do something even worse, or even in addition to that. I mean, not worse, but in addition to that. They treat fertility like it's a disease by using potent steroid, hormones or medications. And as can be expected, the side effects are worse for chemical contraception. So Humanae Vitae, of course, is why we're all here today. And we know that Blessed Pope Paul VI got it right. He predicted, and I would say prophesied, consequences to the widespread use of contraception, which have all come to pass. I don't think there's any debate about this. Increase in marital infidelity, lowering of moral standards, men considering women as a mere instrument of the satisfaction of his own desires, predicting, what led to the Me Too movement, and imposition of contraception by governmental authorities. Right in this room after this talk, Steve Mosher is going to be talking about those. So, I encourage you to hear that as well. But these things have obviously all come to pass, and then some obvious things that he didn't state explicitly, but they're obvious, consequences that have come to pass of this: increase in divorce, increase in sexually transmitted disease, the development of completely new sexually transmitted diseases, and an increase in abortion. So I want to just mention here, and this again is under the heading of sociology, contraception and divorce or separation. This is a study done by Richard Ferring from the and published in the Lineker Quarterly, where he looked at in the survey of the National Survey of Family Growth, the 2010 NSFG. He looked at women who had used various methods compared to what the odds ratio was, or the odds of getting a divorce. And you can see that for the pill, you got about a 26% increase in divorce for people who use the pill. It's actually even worse for barrier methods, oddly enough. I'm not sure why that is, but that's even worse. On the other hand, if you use natural family planning, that decreases the rate of divorce. Now, this is not people who faithfully use natural family planning from the moment they got married through to, infertility by menopause. This is people who have ever used any kind of natural family planning. And in this survey of family growth, that could be somebody who said they used the rhythm method for a couple of months. Okay? So this is not a population that's selected that's faithful to this. It's just any use of NFP at any time decreases the odds of divorce. And what about, so this is divorce, I just mentioned it. You can see that the number of divorces per 1,000 women age 15 and older went up dramatically at the time that contraception became widely available in the 1960s. At the same time, sexually transmitted diseases, which had made a great decrease following the introduction of penicillin, there was a great increase that started to happen around the time of the pill. Now, in terms of gonorrhea, that did go down again with newer treatments and more awareness, but entirely new sexually transmitted diseases started to arise, things like chlamydia and HIV and herpes and hepatitis, 3 flavors, and I could go on and on and on. There's quite a number of these that have come into play. Okay, but what I really want to focus on today is the medical consequences. Drugs typically are developed to treat a specific disease or dysfunction. And I've been doing drug development for over 20 years now. And we know that there's always a dose response for any drug. Low doses of drugs have little or no therapeutic effect. So for example, if you had a headache and took 1 milligram of aspirin, it would not help your headache, right? But if you get up to like 300 milligrams, 600 milligrams, that's a therapeutic dose, it can help your headache, right? And so that's a positive effect at higher doses. But then if you keep increasing the dose, and we know that all drugs have side effects, and these become more common and more severe as you keep cranking up the dose. So if you take 10,000 milligrams of aspirin, you're going to probably have a bleeding ulcer, and you're going to get ringing in your ears, I can tell you that for sure. You can get pulmonary toxicity. Bad things can happen at high doses. So when you develop a drug, you're always looking for the sweet spot, which we call the therapeutic window. And that's the relationship between dose and therapeutic side effect, and that summed up in this therapeutic window, and I'm going to show you. So if you have an effect, either a good effect or a side effect, compared to the dose, you're going to see that that's going to increase as you increase the dose. So here's your good effect, your therapy. There's a dose response curve. It tends to be very little good effect at very low doses, and then it goes up and kind of plateaus off after a while. But then you can also have your bad effect, toxicity, and that hopefully will start at a higher dose. And that sweet spot in between is called the therapeutic window. Well, how does this apply to contraceptives? There is no good effect because you're not treating a disease, right? What's the disease that's being treated? There isn't one. Now, I'm not saying that hormonal agents can't be used to treat some disease states. I'm talking about contraceptives used for contraception, right? You're not treating a disease. So all you really have are side effects. So what are the common ones? Well, one of the things that these chemical contraceptives do is they put women in a state of, tricking their bodies into thinking they're pregnant. Now, how many of you out there have been pregnant? Okay, how many of you loved that feeling of being pregnant? Okay, well, some of you did, but I'm talking about these kind of things, right? This is from the Yaz prescribing information. People, how many of you really enjoyed that nausea you got in the morning, right? That was a good thing, right? How about the vomiting that happens sometimes? And the other GI symptoms, the cramps, the bloating, breakthrough bleeding, spotting, changes in flow, amenorrhea. Temporarily infertility happens after discontinuation of treatment with contraceptives. And then you have other things that happen. Edema. People enjoyed that, right? That was a good, no, nobody put their hand up for edema. Okay. But then there's more. And melasma is a discoloration of the skin that can persist. Breast changes, tenderness, secretion, enlargement, changes in weight or appetite can increase or decrease. Change in cervical ectropy, and that's basically the inside of the uterus kind of coming to the outside, and secretion. You can have a diminution of lactation, especially when given immediately postpartum. You can have cholestatic jaundice, right? Jaundice, that's not fun. Migraines. Anyone want migraines? No. Allergic rashes can happen. Mood changes, including depression, right? These are actually very common on chemical agents. And there's more. Reduced tolerance to carbohydrates. Now, that, if you're not a medical person, that's like, oh yeah, reduced tolerance to carbohydrates. Yeah, yeah. No, that's like diabetes, okay? That's not a good thing. Reduced tolerance to carbohydrates is a very bad thing. But in the label, they just call it reduced tolerance to carbohydrates. They don't say you could get pre-diabetes or diabetes. Vaginitis, including candida infections. Change in the corneal curvature, which can then lead to intolerance to contact lenses. Decrease in folate levels. That can cause anemia, by the way. Exacerbation of lupus. I'm a rheumatologist. I've treated patients with lupus. It's not a good disease, okay? It's a very, very serious disease. It can be exacerbated on these chemical contraceptives. And so can porphyria. It's a rare disease, but very severe. And chorea, again, a rare disease, movement disorder, can be very severe. Aggravation of varicose veins. And anaphylactic reactions, which means that you could go into shock and those kinds of things. That's very rare, but it does happen. So these are the combined hormonal, the estrogen plus progesterone pills. These can do all these fun things. But the progesterone-only ones are also full of different side effects. In fact, they have a lot of menstrual complaints that are induced in women who take these. And it's actually, women dislike the progesterone-only contraceptives even more than the combined oral ones because these side effects are so common. And so you can see they can get all kinds of menstrual disorders, increased flow, on and off flow, oligomenorrhea, which is on and off, spotting, different times, premenstrual syndrome can go up. So all of these menstrual disorders happen. And interestingly, typically what you see with a lot of drugs is that you'll get a lot of side effects in the first year, and then the people who have those side effects and don't like them stop taking the drug. And so then when you continue to dose, like years 1 to 5, then you'll see a decrease in these things because the women who had those side effects stop taking them. But for these, it actually keeps happening. So this is something that continues to be present for women who are using these progesterone-only side effects, contraceptives. And then they also have a wide number of other general side effects that are seen. Now, not all of these are necessarily caused by these agents. So, for example, headaches in 25% of women, well, there's probably 25% of women who get headaches in the course of a year. So that may or may not be caused by this. But some things clearly are: the vaginitis, the weight increase, the acne, the breast pain, the dysmenorrhea, the emotional lability, all those things are very, very likely linked to the use of the contraceptive itself. So what about cardiovascular risks? Because now let's talk about things that are a little bit more serious. All the things that I've mentioned so far are temporary. You stop taking the pill, they go away, right? Not that big a deal. You can always just stop. But there are some things that don't go away. So for example, venous thromboembolism. That's when you get a clot in your leg and it can break off and travel to your lungs or other places. That relative risk is 3.5%, 3.5. That means like a 350% chance of getting this, or 250% increase in the chances of getting venous thromboembolism for women who are on combined oral contraceptives. Myocardial infarction, okay, that's heart attacks. The increased risk is 1.6 for heart attacks. For stroke, 1.7. These are major increases in risk. This is not trivial. And increased risk in cardiovascular mortality. Now I'm going to show you something that very cleverly was done in the labeling for some of these. So this is in the YAS prescription labeling. Circulatory disease mortality rates per 100,000 women years. So like a rate of 1 would be 1 cardiovascular mortality out of 100,000 women in 1 year, okay? So that's what this means. So this is the table that's actually right out of their prescribing information. And if you look at this table, it looks like, wow, smoking is really bad. I mean, look at that. If you use contraceptives and smoke, that's a really big increased risk. And I think most physicians know enough to tell women who are taking contraceptives not to smoke because of this increased risk. But it's very deceptive the way the columns are arranged here, because it makes it look like the big problem is smoking, right? If you just rearrange the columns a little bit, this is right from the YAS prescribing information, you can see that controls non-smokers, let's say 25 to 34-year-olds, 2.7, circulatory deaths per 100,000 women per year. But if you're an every user, that more than doubles. And in fact, the effect of the contraceptive is greater than the effect of smoking, right? And then if you combine the two, then it's really a huge increase in risk. But look at women who are 35 to 44, and women especially who are 45 over who are using these agents. You can see that the risk of cardiovascular death from contraceptives is greater than that for smoking, okay? And it's not brought out in the way that they have the labeling here. All right. There is an epidemic in our country, and actually in the world, of breast cancer. This is a huge problem. The company that I work for right now, this is what we're trying to do, develop new treatment for breast cancer. But the World Health Organization has recognized that combined oral contraceptives are group 1 carcinogens, especially for breast cancer, as well as for cervical and liver cancer. And there was, and breast cancer really is much more important in terms of prevalence in women than any other type of cancer. If you're a woman and you get cancer, the odds are very high that it's going to be breast cancer. 1 out of 8 women develop breast cancer. One meta-analysis showed that the odds ratio for getting breast cancer was 1.08. That's an 8% increase, although more recent studies put it higher, and I'll show you those in a second. And the risk is much higher if you've used these agents prior to the first full-term pregnancy. Now, in our society today, with the hookup culture, what proportion of women do you think are using these agents prior to their first full-term pregnancy? I mean, I don't know the number, but you know that it's very, very prevalent. A recent large cohort study, this is what I was talking about, of women who were followed for an average of 10 years or 11 years, showed the relative risk of breast cancer was 1.2. So that's a 20% increase for current or recent users of chemical contraceptives. And the risk increases with duration of use. It continues, and it continues even after discontinuation for at least 5 years for women who've used it for 5 years or more. This is a little look under the hood, so to speak. I don't want to go into great detail on this, but you can see that there's quite a number of studies that have been done on the use of chemical contraceptives and breast cancer. And I show here just cohort studies. Cohort studies is where you have a large cohort of people and you follow them over time and you look at the incidence of different things. I'm not showing you case control studies, which there's probably twice as many case control studies. Case control studies are when you get a group of women, for example, who have breast cancer, and then you get a group of controls who match them for like age and demographics and things like that, and then you look at the risk. Cohort studies are generally felt to be a little bit more reliable. But you can see that the increased or the relative risk goes from 1.2 all the way up to 1.8, and for certain groups, for levonorgestrel-containing contraceptives, for example, it's 3.05. So it's very, very high for ever use of these agents. And then current use, it's even higher. So there's a lot of studies. A couple of studies did not show the effect, but in general, the vast bulk of the studies show that this is a very increased risk. What about other cancers? So from an NCI fact sheet, National Cancer Institute, you can find that women who have used oral contraceptives for 5 or more years have a higher risk of cervical cancer. It's a 10% increase for less than 5 years, 60% increase for 5 to 9 years, and 120% increase for 10 or more years of use. And then, but we have to admit that there are decreased incidences of endometrial cancer and of ovarian cancer. But as I mentioned earlier, endometrial cancer, ovarian cancer, the incidence of those is so much lower than breast cancer that really the effect of breast cancer kind of swamps that out. So even the use of, although the use of oral contraceptives is significantly associated with decreases in ovarian and endometrial cancer, the increase in breast cancer risk is offset by the huge incidence of breast cancer. So it's very likely that overall, the number of cancer cases in women is substantially increased by the use of these chemical contraceptives. There's also some less well-known effects of chemical contraception that we're studying at the Catholic Medical Association and affiliated groups right now, and hope to have a petition out to the FDA later this year to try to get some of these into the labeling because it's not there right now. This includes increased susceptibility to autoimmune diseases. So estrogens are pro-inflammatory, and we know that the female sex is associated with the development of most autoimmune diseases. Most things like lupus, rheumatoid arthritis, et cetera, much more prevalent in women. And there's a clearly increased risk in Crohn's disease. This is a very severe inflammatory bowel disease. The relative risk is 1.44, 44% increase in one large meta-analysis of multiple studies. There's also an increased risk of ulcerative colitis. Again, a very severe inflammatory bowel disease, 28% increase in risk in one large meta-analysis. And lupus. Now, there haven't been any meta-analyses, but virtually every study that's looked at the risk of getting lupus shows a 19 to 130% increase in the relative risk of developing systemic lupus. And then there's also increases in multiple sclerosis, interstitial cystitis, pemphigus, a very severe autoimmune disease of the skin, as well as eczema, which is very common, and psoriasis. There is no effect in the survey that I did of rheumatoid arthritis or hypothyroidism. There is a decreased risk, we have to be honest about everything, in hyperthyroidism, okay? And that is a very prevalent autoimmune disease. But overall, and there's a possibly decreased risk of primary biliary cirrhosis, which is a very rare autoimmune disease. So, but clearly, quite a number of autoimmune diseases are linked to the use of chemical contraceptives. And there's also progesterone-only contraceptives. There was one large third world cohort study, And this showed a clear increase in different types of arthropathies, that's arthritis basically, and other disorders, as well as eczema, contact dermatitis, and pruritus, which is itchy rashes, as well as alopecia. I don't know anything about alopecia myself, and then there's acne and urticaria. So the progesterone-only agents also have these risks. And they also have the risk of breast cancer, by the way. I should have put that in. You don't get it out of these risks by using the progesterone-only agents. But there's additional things that can happen. And this is from some reviews that have been done recently in the Lineker Quarterly. If you use contraceptives during adolescence, it actually changes your brain structure because virtually every cell in your body has steroid hormone receptors, okay? And so these receptors are in the neurons and they're there as they're developing. So you can actually see quantifiable changes in brain structure. There is effects on mate selection. Okay, this is something that Janet Smith, who's talking next door, has brought to the fore of our consciousness. But it's very clear, multiple studies show this. There's a decrease in libido. This always cracks me up, you know. And depressive symptoms, right? And an increase in divorce as well for sociological. But, you know, women, why do they take the pill? They want to take it so they can have sex. But what does it do? It decreases their desire to have sex and makes them depressed about it. So that's something that just doesn't make a lot of sense to me. And yet we do it. Let's contrast that for a moment with the natural methods. And, you know, I feel like I've been telling the bad news, you know, as opposed to the good news. We're all about the good news, right? The gospel. But I've been telling the bad news. But here's the actual good news. Natural methods of birth regulation, such as natural family planning, fertility awareness-based methods, the Creighton model, etc., these respect the intrinsic link between the unitive and procreative aspects of the marital act and respect the dignity of the partner, not using them as an object for selfish pleasure. They're associated with better communication between spouses, lower divorce rates, and lack of the intrinsic health risks of chemical contraceptives. So these clearly are superior if we could just get people to know about them, because I guarantee you that the vast majority of people in our culture today have never heard of NFP. I mean, we do pre-Cana all the time, and that's one of the questions that's always asked. How many of you have heard of NFP? And this is, you know, people getting married in the church. So they're Catholic, and they're actually getting married in the church. They're like, you know, a select group in some way, and it's always a minority who have heard of NFP. So how do we get the word out there? Well, I think that we're at the point now we need to be start being serious about evangelizing these things. And so one of the things we've done at the Catholic Medical Association is put together a series of audio files, radio spots, that are available for free download that you can send to your local radio station and put them on the air, okay? You can do this. You don't need anything. All you need to do is go to the Catholic Medical Association website, cathmed.org, fish around a little bit until you find the stuff for the radio ads. It's in there. You might have to do a few clicks, but you'll find it. And then you'll get something like this.
The Catholic Medical Association supports your right to know. The birth control pill has been available for over 50 years. When it was released to market in 1960, it was thought to be a miracle drug that would free women's lives and improve family life. However, now we know that women who use the pill for a minimum of 4 years prior to having their first baby have a 52% higher risk of developing breast cancer, while women who use the pill for more than 5 years are 4 times more likely to develop cervical cancer. Prior to the pill, there were 5 sexually transmitted diseases. Today, there are more than 50. The pill has major side effects for the woman, such as weight gain, depression, stroke, and heart attack. Modern methods of natural family planning are more than 95% effective and have no harmful effects on the woman. The Catholic Medical Association supports your right to know. To learn more about natural family planning, visit the Catholic Medical Association website, cathmed.org.
So those, and there's, we have them on abortion, we have them on same-sex marriage, homosexuality, a whole variety of different topics. There's radio spots. So you can actually download these and get them on your local stations. But thoughts on evangelizing the culture, right? How do we get the good news out there? How do we do it? Well, we live in a society of catchphrases and one-liners, right? Twitter, everything's Twitter, Snapchat, all these things. It's got to be catchphrases and one-liners. And I have to admit, I've heard a number of people say, well, the Catholic teachings are complex and it's hard to boil them down to these one-liners and, we're at a disadvantage in this and all this stuff. That's baloney. I don't accept that whatsoever because Jesus is the master of one-liners, right? As I have loved you, so you should also love one another. Let he who is without sin cast the first stone. Blessed are the poor in spirit. Theirs is the kingdom of heaven, right? He changed lives and hearts with one-liners. So we need to have our own one-liners, and that'll help us. So I've got a few that I think can help people here, but let's just go through a couple of them here. God gives us a choice between life-giving love and sterile sex. Choose wisely. Choose life, right? Fertility is not a disease to be treated, but a blessing to cherish. Oral contraceptives are really sterilizing steroids. They are not performance-enhancing steroids, they're performance-inhibiting steroids. All family planning should be natural. Real men use NFP. We should love people and use things, not use people and love things. That's Bishop Fulton Sheen. And love is life-giving. Lust is sterile. True love is free, total, faithful, and fruitful, which I heard first from Christopher West, who's speaking tomorrow. True love holds nothing back. And I want all of you to add your own. We should actually start a website somewhere just to add one-liners, right? So that we can all share each other's. So in conclusion, humans are a profound unity of body, mind, and spirit, and spiritual sickness or sin has medical, psychological, and sociological consequences. The marital act is the most fundamental human relationship, and altering that act will have effects on relationships. Chemical contraceptives worsen this by treating fertility as if it was a disease. Chemical contraceptives have a wide range of medical, psychological, and sociological consequences. Women should be adequately warned about these consequences, and NFP does not have these consequences, but instead strengthens marriages, helps spouses grow spiritually. And now for my shameless plug. Okay, this is a book that my wife illustrated, and it is a Catholic perspective on how and why God made babies wonderfully made for ages 9 and up. It's basically theology of the body for kids. So that's the end of my talk. But you can get this from One More Soul, by the way. And I invite any questions. Yeah. Yeah, the IUD has a lot of bad side effects, and you can just tell them that women have died from using IUDs, which we know, but clearly higher incidence of, and I didn't put those in here, focusing on the chemical ones here, but they get inflammation in the uterus, they can get pelvic inflammatory disease, they can become permanently sterilized because of the inflammation from using them. So clearly bad, but the diaphragm is like other barrier methods. It basically has mostly sociological consequences. So you can tell them that, well, if you want to be used as an object, then that's a great thing to do, to use a diaphragm, because that's basically what you're telling the men that you're with, that you can be used as an object and that it's not respecting your totality as a woman, right? Right? Women are complete people. That includes their reproductive system, you know? It's not something that is a disease or something that needs to be shut off. Yeah. Right. Yeah. Yeah, people go on birth control for acne all the time. I just met somebody the other day who was on it for that. There's a lot of other good treatments for acne, for crying out loud. I mean, look at the risks here we're talking about. We're talking about cardiovascular death increased. We're talking about breast cancer in the long term, especially, you know, if it's before the first pregnancy, the risk for breast cancer goes way up. We're talking about autoimmune diseases. They don't go away. They're bad. You know, the problem with the pill is that a lot of the side effects, the serious ones, are a little bit delayed. And so, you know, you have to ask, you know, is it really worth having a clear complexion to get breast cancer in 10 years or 20 years? Is it really worth it? Yeah, over here. I'm sorry, the what? Oh, HPV vaccine. So HPV vaccine, from a moral theological standpoint, is not necessarily bad. It has to be done for the right reasons. Now, I don't recall off the top of my head if it's manufactured using human-derived embryonic, you know, fetal-derived. I don't think it is. I think it's manufactured in an illicit way. I just don't know that off the top of my head. So I don't necessarily see anything wrong with people having HPV vaccine. On the other hand, if there is someone who knows that they're going to be chaste until marriage and after marriage, in other words, one partner throughout life, there's really no reason to use it. And I don't know that much about the risks associated with it. I haven't read up on that very much. So I can't say too much more about it. But I know that it's not immoral to get vaccinated. On the other hand, if someone is planning on being, you know, faithful throughout their life to one person, it, you know, decreases the reasons to have it. Yeah, no, I haven't heard as much as you have. So the point was that the manufacturers, you know, are now saying that it doesn't prevent cervical cancer as much as they had hoped it would, and also that there's been deaths in people on Gardasil, and that there's been other side effects reported. So I'm not as familiar with that literature right now, so I apologize for that. Yeah, her question was, you know, about the HPV vaccine, to make a comment on it. I just repeated pretty much everything she just said. Okay? Yeah, that the HPV vaccine is not necessarily protecting women from cervical cancer, that it does have side effects, that there have been deaths on the vaccine, and that there's been other side effects that have been reported. Okay? So, yeah, back there, I think you were next. Yeah, it's really hard to hear. There should have been a microphone, so we only have one microphone here. So.
Well, I read the book Wonderfully Made to Our Children, and it is a wonderful book. It has a very positive view of sexuality, so I would give it a plug as well. And the other comment I wanted to make is, in case you're not aware of NAPRO technology, which gets to the root cause of reproductive disease, so that girls or women don't need to go on to the birth control pill to be treated. It just masks the problem. And so a better way is with NAPRO.
Right, absolutely. And so that's a great point. That NAPRO technology is a great way to help women understand their bodies, and it actually helps diagnose diseases that can happen, especially affecting fertility. Yeah.
So I kind of got scared a little bit because for my last pregnancy, I have to be treated to prevent a preterm birth, and I was on progesterone for most of my pregnancy. So I'm looking at all the side effects that you were giving, and I was not told that.
But that's a different situation. That's a different situation, yeah. Yeah, because when you're taking progesterone while you're pregnant, you're basically doing what your body ought to be doing. You're giving the natural hormone, first of all. It's not a synthetic, steroid. And then the other thing, as opposed to Implanon and those things, which is definitely different. So be at peace. Be at peace.
There's a relation with using contraception. Like there is a possibility of sterilization when the teenagers are using contraception.
Yes, there is, and for actually a couple of reasons. One reason is that there is long-term infertility in some cases after contraceptives, but also, since it promotes promiscuity, then you have a higher chance of pelvic inflammatory disease, which can scar the tubes and cause infertility. So yes, that actually happens as well. Sorry.
I was just gonna say to this lady here that sometimes you need progesterone even outside of pregnancy for PMS or lots of things. And that's why you chart so that you can take it at a specific time in your cycle. Not every day, but at the end, at the post-peak phase. So that's totally safe. Right, bioidentical is the best, yeah. Thank you.
Yep, over here.
I was wondering if you could comment on the relationship between sterilization and maybe some autoimmune diseases or other negative consequences.
So I'm not that familiar with the relationship between, for example, tubal ligation or vasectomy and autoimmune disease. I haven't had a chance to look at that literature. I'm not sure what's out there. But clearly there's a very negative impact on marriages. Clearly the divorce rate is much higher. And again, it's the same root problem that you're treating each other as objects instead of as full people, as a human person with intrinsic dignity. So I think sterilization, of course, the other obvious problem is that it's surgery, and there's risk for any kind of surgery. So I haven't had a chance to look into the other ones that you're mentioning right now, but there clearly are a lot of negative consequences, especially sociologically. Yeah.
Just a quick response. I'm a Creighton model educator in Houston. I work with Dr. Stephen Hilgers, and he's an OBGYN at Methodist. And we're seeing a lot of women who have had tubal ligations come to us complaining of severe dysmenorrhea, severe problems with dyspareunia, and PMS symptoms.
Yeah, and I think that's interesting, but unfortunately, without some kind of controlled study, it's anecdotal. And I've done drug development for 20 years, so I know the difference between a controlled study and a not controlled one. So these things are interesting initial observations, but it should be followed up by a controlled study, or maybe looking at a cohort study would be another way to do it. Like the nurses cooperative group, they have a cohort of nurses that have been followed for, I think, over 30 years now. And so you could go to their database and say, okay, let's pull out all the women who had tubal ligations, and let's pull out women who didn't, and look and see if there's a different incidence of some of these things. So that's kind of what should be done. Can you hear the microphone?
I would be curious to hear your perspectives on what I have heard about how male birth control, not that I am advocating for it, but the politics behind why pharmaceutical companies have developed tons of women's hormonal contraceptives and all sorts of things, but there's, nothing on the market as far as I understand for men. So I'm curious about the politics about that.
Yeah, I mean, it's a great point, and I think a lot of people here probably are familiar with the information that came out around the development of the first hormonal contraceptive back in the 60s, that at the time they were developing at the same time male contraceptives. And during the study in the women, which was mostly done completely unethically, by the way, in Puerto Rico, without giving proper informed consent or even telling the women what they were doing, it was a completely unethical study. But there were 2 deaths on that study, and probably, I think, related to the cardiovascular risk that's there. And in the study of men, I think 2 men had their testicles shrink, and so they said, well, we can't tolerate that, but the women die. Okay, well, that happens sometimes. No, but it's it's a really good point, and I think you have to. I'm not quite sure how to put it. We say we've had such a male-dominated society. This is, to me, it's a case in point of it. That men are, want to be able to have intercourse whenever they want to, and they kind of can anyway because they think the baby is the woman's problem, and so any side effect has not been tolerable or tolerated by men. On the other hand, women have to put up with all this stuff so they can be used by men. It doesn't make a lot of sense. And I'm not sure that it's really so much politics as it is commercial aspects of it. Because they know men wouldn't buy it. They know that they wouldn't. And somehow women do. Now that's a sociological question that's completely out of my realm. I still can't figure out why that is. It just doesn't make any sense to me. So can you hand this back?
Hi, I am Angelica Sarmiento from Paraguay. I'm a gynecologist. So I just would like to do some comments on several questions that have been done. So to the person that asked about diaphragm, what could you tell to a friend, using diaphragm? So something that is really interesting for me when I tell my patients is that when a woman uses, and a couple, uses barrier method, either condoms or diaphragms, there are a lot of substances in seminal fluid, that actually interact with the uterus to help the woman to be, having the good effects of the sexual intercourse. If there is a barrier method, then the woman does not receive that chemical interaction and she feels no pleasure out of it. So when you tell this to women, they get oh, so it's not that good for me to use it, if I'm gonna have sex but not have any pleasure out of it, then what's the point, sort of thing, if I'm doing it for pleasure? So that helps a little bit to, in addition to that, separation of unity and procreative aspects of the relationship. Then about the vaccination, about HPV, something really interesting is that there are more than 40 different types of HPV. And the 2 types of vaccines that are available, one of them only prevents 2 out of 40, and the other one prevents 4 out of 40. So that's not a prevention at all. And what happens in our countries, like South American countries, is that the vaccines have been made in northern countries, like America and Europe. So those 4 are not the ones that are more popular in our countries. So actually, we're not receiving any kind of help by that. And it's sold to the women, to the parents, telling them, you're going to prevent cancer, cervical cancer in your daughter. So it's a lie, because they're not the type of HPV that it is producing cancer in our countries. And also there are 36 other possibilities that are not being covered. And also that vaccine, promotes promiscuity, so the girls are gonna have like all these other kind of things like AIDS, chlamydia, wherever, all the others. So I think that we have to be, tell the people what's going on, because some people think that it prevents all kinds of, all types of HPV, and they don't. Then that other question about sterilization, like tubal ligation and men sterilization, well, there are some really good and interesting studies about how when you do a tubal ligation, you have to actually cut the tube, and the ovaries receive half of their irrigation through the tube, because the ovary is actually sort of hanging from like a little ligament that it comes from the wall, and another little ligament that comes through the tubes. So when you cut that, you sort of cut half of the irrigation that the ovary is receiving. So it's very well known, and it's been very well demonstrated, that when a woman has a tubal ligation, the ovaries have like half of the irrigation, so they become ovaries that do not have ovulation every month. That reduces the percentages of ovulation almost 0.5%. So that woman has like half of the cycles after the tubal ligation that you have a very high level of estrogen, but that is not, properly antagonized by progesterone, but because you only have progesterone in a cycle that you had an ovulation. So women that have sterilized, like by tubal ligation, has a lot more of problems in the lining of the endometrium, like much more cancer, like endometrial cancer, endometrial hyperplasia, much more bleeding during the menses. You also have like all the illnesses that are increased by an increase of estrogen, then they are increased in women that have tubal ligation. And in the case of the men ligation, like vasectomy, there are really good articles linking immune illnesses, because it is well known that, the sperm are produced in the testicles, and then they have to go up, through the tubes that are cut. So there's like the sperms die in the testicles, and so there are a lot more of antibodies built in those men, and so they have a lot more of immune problems. There are different kind of autoimmune problems. So there are a lot of studies about that. Thank you.
One more. Yeah.
At what age do you recommend us teaching kids regarding contraceptives dangers? And should we also teach natural family planning at that time?
That's not an area I have a lot of expertise in. Anybody an expert in that who wants to answer? Because so far the audience has known much more than me about these things. I have, there's 2 people raising their hand already. So, I have to say that this has got to be somewhat individualized based on the family and the culture, but.
Yeah, there was recently, and I can't remember if it was the American Pediatric Association, but talking about how girls should learn about their cycles. I just actually taught a 14-year-old how to track, and there's ways to do it where you're not focusing on necessarily the family planning aspect, but they're actually, it's brilliant how they take to it. And you can use a modified calendar chart or whatever, but yeah, I've had people as young as 14 and 15. Now some would say younger than that, but You can do it with younger girls, but you would have to modify, the presentation.
And somebody else wanted to comment on that here. So I mean, I think I would say to be aware of the Teen Star program, which is very, very good for teaching women from a very young age, about their cycles, and young boys too, so that they can learn to respect each other.
My husband and I give these Engage Encounter weekends, and you'd be surprised how many people have never heard of NFP, these 20, 30-year-old, 40-year-old people, and it makes me sad that the Catholic Church, we were talking about, could do a better job about this. So I think as early as you can even by 6th grade start talking about the woman's cycle. You don't have to get into all the gory details, but the respect of the woman's body and the respect of the cycle and all. I don't think it's ever too, I don't say ever too young, but 6th grade at least, where you can start talking about the respect of the body and how it works. But we need to get the message out there because a lot of people just don't even know anything about this. There's no commercials on TV. They don't sell anything. It's like the Catholic Church's, I think, best kept secret that we need to get the message out there.
Yeah, I agree. And the Wonderfully Made Babies book does start at ages 9 and up. So again, that's a nice resource that's out there if you want to get to it. I think we probably have to stop, unfortunately, because our time is up. But I want to thank everyone for coming, and I want to thank all the expertise in the audience for sharing. Thank you very much. God bless you.